Hi guys, my name is Candace Carter and I'm going to be performing another part of my head to toe assessment. In this part of the head to toe assessment, I'll be um, assessing the skin, the head, the neck, the eyes, and the ears. So let's begin.
Amen.
Hi, my name is Candace and I'm going to be your nurse today. I'm going to go ahead and perform the rest of your head to toe assessment. Is that okay?
Yes.
Okay. And can I have you verify your name and date of birth?
Joyce Bryant, 0704 1994.
And do you know what year it is?
Now?
Yes.
2012.
Okay. So we're going to go ahead and begin. First, we're going to check out the patient's skin. The patient's skin is warm and moisturized. It's not dry. Skin is also appropriate for ethnicity. He doesn't have any scarring. He has facial hair. He has a little rough, dry patches around his nose area. Let me touch my face. And we're gonna go ahead next and check out his head. So I'm feeling for any lumps, bumps, and any abnormalities. Patient's head or hair is thick, no baldness. It doesn't look like there's any infestations or things of that nature. Patient's hair color is brown with the tips of it being blonde due to hair color. Now we're going to go ahead and we're going to assess the patient's lymphatic system. I'm going to go ahead and start by palpating the preauricular area. Then I'm going to go and move to the back, which is the posterior auricular area. And then we're going to follow suit to the occipital, followed by the jugular digastric. I don't feel any hardness. The lymph nodes are soft and movable. We're going to go to the submandibular and move your way down and in circular motion, followed by the submental, which is here, I believe. Now I'm going to have him turn his head to the side. We're going to do one side first. We're going to feel for the anterior cervical chain, just in front of this, what am I wanting to say? This right here. So we're just going to palpate. I feel 3 chains. And we're going to go to the posterior cervical chain, which is in the back. I'm just going to move my hand alongside that chain. And now we're going to do this deep cervical chain. Any tenderness?
Yes.
Yes.
No.
Okay. So his lymph nodes were soft, movable, and there is no tenderness. I'm going to have him go to the other side. And I'm also going to do the same thing on the anterior. I'm going to move my fingers alongside of that chain. And we're going to go to the post-cervical chain. And the deep cervical chain. Any tenderness?
Yeah.
Okay, so he complained of tenderness at the top of his lymphatic system, or his lymph nodes up to the top. So I am going to note that and also bring that to the doctor's attention. Patient's head size is normal. Next, we're going to inspect the eyes. Patient's eyes are symmetry to his face, along with his eyebrows. They're also symmetry to his face. If you look at me, his pupils are also symmetry to his face. Some other things that we could do, if we were able to do, would be the Snellen chart, which actually tests for visual acuity of the eye, and we should read that card about 20 feet. And for nearsightedness, we will do the Jagar card, but we're not going to do that. We're just going to skip over that. I'm going to go ahead and check his pupils with the pen light. I'm going to come in from the side. And as I go onto the side, the patient's pupil on this side, which is the left side, restricts. That's your right side. Sorry, the right side. That's that's the right side. I'm going to do it to the left side to see if the right eye restricts. And it does. Now we're going to go ahead and we're going to test ocular movement, which is cranial nerves 3, 4, and 6. So I'm going to have you to follow my finger. I'm going to start at 3. We're going to go to 6. Thank you for not moving your head by hand. We're going to go down. And then this way. Okay. I don't show any stigmatism or his eye twitching, so that's a good thing. I'm going to check your sclera, which is inside your eye. Sclera is pink. No watering of the eyes or anything like that. Okay, could I have you to move your eyebrows up and down? Could I have you puff your cheeks? And could I have you smile? Smile is even. Both sides, it doesn't show like there's any type of deformities or disorders such as a stroke or anything like that. I'm going to have you to, I'm going to bring the light in. Patient's pupils do restrict. Now we're going to inspect the ears. Patient ears are a little big, but not too big. It's normal. Patient skin on ears is appropriate for ethnicity. No piercings of any sort. Skin is intact. I don't see any discharge, which is good. I'm going to go ahead and palpate around the ears. Just touch and see if there's any tenderness. Is there any tenderness? Okay. Using the automanoscope, you would then look into the patient's ears, and it'll actually show the cone of light inside the ear should be a pearly gray color. Also, when you are checking inside the patient's ears, you're going to hold the ear up and back, and you want to place the automanoscope upside down and look in. You never want to cross your hands when doing so. Patient's cone of light will be at 5 in the right ear and at 7 in the left ear. We're going to perform the whisper test. For the whisper test, I need you to put your finger on your tragus and like push it in and out, and I'm going to whisper something to you, and I want you to repeat back what I'm whispering to you, okay? Did you hear that? What did I say?
5, 7, 9.
Okay, so we're going to do the whisper test on the left ear. Did you hear that?
Mm-hmm.
What did I say?
5, 7, 9.
Okay, thank you. And that concludes the portion. Oh, I forgot one. Correction, I did forget one, and I am going to go back. I'm just going to go back just a little bit because I forgot one part of the lymphatic system, which is the supraclavicular, which is located here in the bends of the neck. Is that tender? Okay. Hopefully I don't get knocked off for that. But I did forget, but I did come back that concludes this video. If you have any questions or concerns, email me. Thank you.